Hi, everyone who's joining. Thank you for being on the spot. I will say that this is a webinar. It's a time that people are usually having lunch and come and go. And we do find that we had a significant number of people who joined us asynchronously last time through the video that was shared out and also put on LinkedIn. So if you do have to hop off and you don't want to miss the conversation, do not worry. You'll have plenty of opportunities. Um, I guess let's go ahead and kick this off. It is 11 o'clock and y'all have a lot of information. I want to make sure that guests live today and on the back end get to hear. So welcome to Real Talk, Plastics in the System. I'm Holly Fletcher with Greenwell Project, and today we are talking about plastics, which have entered the healthcare system decades ago as a patient safety innovation, and now they are everywhere, having taken over like kudzu. And while none of us here created that situation, we all have a hand in dismantling it. And so that's what today's conversation is about. We know that we are not heroes who can save everything. This is not just a highlight reel of what wins. We have three very different physicians who have separate playbooks and perspectives, and that they're all working towards the same goal. Sustainability, just as a reminder, whether it's in healthcare or other parts of of industry, it's a practice and it's not the work of a person. It is the work of teams who are building healthier systems one department at a time. So, with that said, I would like to kick this off with Elizabeth, who will tell us about what she does.
Thank you so much for having me. I'm very excited to be on this panel with all these distinguished guests and moderator. I'm a psychiatrist, and actually a lot of my career has been medical education. And I really got into the sustainability side of things through an environmental lens, really, and initially became more of a personal goal of mine. And I didn't really think they overlapped. But once I actually saw some of the research coming out about the different health impacts of plastics and potentially microplastics, and then I was able to look into the broader literature of decades about endocrine disrupting chemicals, which are a component of plastics as well. It really led me to see how I could leverage my expertise as a physician as well as a professor to really provide clear and engaging evidence-based information about how excessive plastic use can harm human health. So I'm coming at it from a public health lens and sort of a communications approach.
Teresa, what about you?
Hi, everyone. Thank you for having me. My name is Teresa Amato, and I'm the VP of Clinical Sustainability and Resource Stewardship at Northwell Health. Been in this role about 4 years. So my journey into sustainability was very circular. It's very interesting. I still a practicing emergency physician, but prior to this role, I was the chair of emergency medicine in one of our community hospitals located in Queens in New York. And during COVID, we were the epicenter of that first wave. And I never thought about resources before. I just called my guy and he got my stuff. And I never really gave any thought to like that I wouldn't have something if I needed it. And it became very apparent during COVID that resources are not limited. And so when I was looking for another role after COVID kind of went in the rearview mirror, I really wanted to work at a system level, and I wanted to work somewhere with procurement and with the teams that got us all the goods that we needed. And along the way, I learned a lot about sustainability and resource stewardship. So when I think about Northwell's commitment to sustainability, we really feel that every person deserves a healthy and safe environment to grow and thrive. But when I talk about the four walls like within the health system, what I really try to do is get 100,000 teammates to look at healthcare differently and to think of resources as that they're champions, right? They're guardians of our resources. And so my sort of approach to plastic is really trying to get people to not waste it, not use it in the first place if it's not necessary. And a lot of that has to do with clinical practice. So my role really in the organization is to try to plastics is one part of sustainability, but a very important part. But it's really getting people to think differently and practice differently. And instead of just grabbing that one-use item and opening it and then throwing it in the trash, did you have to open it in the first place? So really thinking about low value, no value, high cost care. And then ultimately, clinical sustainability to me means driving upstream, empowering communities and people to live as healthy as possible for as long as possible, driving healthcare towards prevention rather than towards that high carbon footprint, really intervention because people got sick because they weren't able to be empowered to be healthy in the first place. So thank you for having me.
Thank you for being here. Annie?
Thank you for having me as well. I'm Annie Halsey. I'm a family physician, and I thank you, Dr. Amato, for that segue. Speaking of prevention and communities, that's really my wheelhouse. And I entered this space really just from a personal interest. I come from a long line of conservationist family members, a few scientists, and I've just always had an eye towards conservation and protection and minimal use. And so I fell into it serendipitously. I decided last minute to attend an American Academy of Family Physicians conference in Washington, D.C., where I was living at the time. And really, that was my introduction to the whole concept of sustainability, climate, and health, although it had always been in my mind in the background. I am certified in lifestyle medicine. So that was my open door, really. I spend a lot of my time, both professionally and personally, thinking about food and food systems. And you don't have to go very far at all to find plastic. And one year for a New Year's resolution, I decided to use as little plastic as I could. This was several years ago. And that really put plastic on my radar. And it's everywhere in healthcare. It's one of the reasons I did not choose surgery as a specialty. I couldn't handle producing so much waste. So I'm practicing here in the Northeast in New England currently, and I'm fairly new in my role here. And I'm looking forward to being back in a health system to help make some good change. Thank you for hosting this discussion, Holly.
So further about how we're tackling this today. I mean, I'm sure everyone who is either a speaker or an attendee knows that you can't get very far in life without seeing plastics in a headline. It really is just kind of at the top of the zeitgeist in cultural conversations right now, and it can make a lot of people feel very hopeless or unsure about how they can tackle this, especially when, Annie, to your point, if you're shopping at the grocery, even if you're trying to be mindful, it is hard to escape plastic. It's ubiquitous in our lives, and even at Greenwell, we've had a series of a radiologist, a surgeon, and Annie document plastic just for a week or one operation and take photos. And I also work at a health system and know that my clinical colleagues are just inundated with waste, but also the mismanagement of where that waste goes. There are so many areas we could focus on, and so I want to ask each of you, what is kind of the problem or the friction point, I should say, that you are actively working on right now? And how does that show up in your daily lives at work? Teresa, let's start with you, because you didn't mention this in the intro, but you've also worked on tracking healthcare workers' climate anxiety.
Mm-hmm.
And so I think that would be a good way to start, because people do see this at work, and it has to grow as a burden to know that you're a contributor.
So I'll start with, we had a sense that people were feeling some urgency around climate change and their effect on their health. And so what we did is, we have a wellness survey we put out to all of our employees every year, and we were able to add on to it some some questions around anxiety, climate change, resiliency, impact to health, and like what they saw as some of the concerns. And we know that not only these are our employees, but these are the communities that we serve, right? We could see the area codes where these folks came from. We then could layer on top of it. New York State has come out with some guidelines of what is a community that's at risk from climate change and healthcare impact. And what we found is when we layered on top of that, people that were at high risk for climate change impact on their health, according to New York State, were also the same people that had really high anxiety around climate change. And, when we questioned people about what they saw at work, it was interesting. People were like, I take home plastic bottles because there's no recycling bins in the hospital. So I take them home to put in my recycling bin. And that's my contribution to try to, so it was really interesting. We had a lot of people on the front line that were super interested in this. But at the time, we didn't really have a structure around how to really decrease our plastic usage. So when we created our sustainability team, we started out with these great ideas, boil the ocean, boil it twice, because everyone's feeling so anxious and we really need to do something. And what we found was we really had to vet when people came to us with ideas of like what was actually scalable, what was actually doable. Because to your point, you can't just decide you're going to recycle plastic. Like when you have a building that's really old and there's not a place to keep those bottles and cans, it's a health system, right? You can't just leave trash. And so we really had to understand each one of our sites and what that meant. And, and again, all these employees that were anxious about it, wanting to participate. So what we did, and I would encourage people to do, is every health system has a pretty strong quality team, because if you don't have quality, you have nothing else. And we embedded sustainability into our quality metrics. And so our plastic and our recycling program is reported up through quality. And I would say that was really helpful to get a handle on how to sort of parse out all of this and how to like decide how we were going to do this. So for instance, our single-use device reprocessing. So we at each of our sites take these single-use device items that are very plastic rich, that are usually used once, and they go to a monitor, but then used once and then they go into the trash. And now we are reprocessing them. And what we did is we found site champions and we put a structure around that. And then we made it very competitive to see like who was collecting the most. And in the program at last year, we diverted 144,000 pounds of plastic from landfills through that program. And if you want to talk about taking the politics out of sustainability, talk about resource stewardship, it's just a really good business model. We also save several $1 million doing that. So it's a good business model. And I feel like for our employees, they felt really empowered and really felt like, wow, we're really doing something. It was very tangible, being really transparent with the numbers. And I feel like that really does speak to that anxiety and that, like, what can I do? Well, here's what your team did. And here's exactly how many pounds you diverted. And here's your carbon footprint impact as well. So I feel like maybe embracing the anxiety a little bit, but then giving people an avenue to sort of figure out how they can contribute to decreasing the plastic usage.
Elizabeth?
Thank you. I really love examples that Dr. Amato provided. I think one thing is not to worry in silence. So your voice is powerful. So, let your supervisor know, or let your hospital know at a staff meeting that you're concerned about this. And the same goes for if you're thinking about changes within your own community or state or country. You can let your representatives know, your politicians know that this is something you're concerned about and you want to know what they're doing to work on it. So, you don't have to be all doom and gloom about it when you're contacting people, but I think the more that it becomes, the more that people who do have some more say or power recognize how much everyone is actually concerned about this, the more we can actually start to affect change. Because otherwise they'll think, oh, this isn't something that most physicians or most nurses are worried about. This isn't something that most constituents are worried about, so I'm going to ignore it. But if they find out that actually a majority of people are worried about it, then they will have to take some action.
Teresa, I'm curious, and we had a couple of questions, or a question that popped up in chat. I wanted to go ahead and ask, how long did it take to get sustainability and the plastics into the quality program, and what kind of reception did you get at the outset?
So a couple of things. We added a nurse to our team, and she was a very strong quality in IT background. And what we did was, again, going back to the business model, you may or may not know the Joint Commission has a voluntary, if you want to get a sustainability certification. And that is now tied to some reimbursement with some of our insurance companies because there's something called QHIP. It's an incentive program from a quality perspective. You get reimbursed at a higher rate if you have a higher quality metrics. And one of the metrics now is sustainability. So it's real dollars and cents. So so that teammate bringing a nurse onto our sustainability team was the beginning of us realizing it is actually a quality measure. I would say for us to be fully embedded into quality, it probably was about a year-long journey. The first thing we did with some key stakeholders, we got the quality folks to believe that this was actually, yes, this is important. By default, you need to get your infectious prevention, infectious disease folks involved, right? Because a lot of this plastic usage stems from people worried about infection, right? If you have a one-use device item and you throw it in the garbage, I don't have to worry about did I sterilize that and is it safe to use on the next patient? So a lot of that came out of the Joint Commission saying, like, how do you know this is clean and appropriate for the next patient? But getting those people on board with that, again, with the reprocessing of the single-use device items, we wanted to make sure we had the highest quality, safe, equipment for our patients. So it kind of just made sense. But true sustainable practice is high quality, right? When you decrease your variation of practice, your safety and quality goes up, your carbon footprint goes down, and you ultimately save money. So it's kind of like we call it the quadruple win. But I would say every health system has a very robust quality structure. I just say meet with those folks and try to get sustainability as part of what you're reporting out on. You don't have to reinvent the wheel. It's quality is ubiquitous for health systems.
Annie, I'm curious, how is the topic of plastics beginning to show up in your professional life? Are patients beginning to ask about this?
I do have some patients who ask, yes. Um, it's not as many as I would like, but it is some. And for those who seem receptive, I may introduce it in a conversation. My goal is really to go back in time to childhood curiosity. Um, be curious, not furious. A colleague admonished us many years ago, and that I think is holds true for a variety of instances we encounter in healthcare and other professions. But really, just ask the question why. Why are plastic specula ubiquitous now and not metal specula? Why are we donning gloves to clean a room, an exam room? What are the risks? Um, why do we not have cloth gowns for well woman exams? Some places do have these items, and that minimizes plastic use. But really, my approach with my patients and my colleagues and anyone who's willing to listen is just ask the question why. Why do we do this? There's an answer somewhere, and it may be surprising. I think we would find if we asked that question more, we would find that we don't need nearly as much plastic as we are currently using.
What has been very striking to me, so I work as an editorial director for an academic medical center, and I can get a look at some of the searches that people do that bring them to our sites. And it is really interesting how over the last, say, 18 months or so, the curiosity about plastics and microplastics are showing up in those AI searches because, search is moving more towards Gen AI rather than the Google or the Bing. But people are beginning to ask about that, and they are coming to institutions that have a reputation for health and research to answer some baseline questions, even if they're very challenging to answer. So I'm curious, and whoever wants to pop on this first can get, are you seeing a change in receptiveness to conversation and action now? And when did that start? And were you prepared to capture that moment and move?
I can give you an aha moment that happened for me. I had two meetings. My meeting in the morning was at the medical school. So I went over to our medical school and I saw all the students and I saw like where they were all congregating. They all had a backpack and they all had a, a reusable water bottle, either attached or sitting right next to their backpack. And then later on in the day, I had to go to our corporate headquarters for a meeting. And I walk into this like large boardroom with this big table and there's single-use water bottles, like just all over the table. And I was like, wow, this is a real big generational gap we have here. And even when we went to eliminate the single-use water bottles, there was a lot of pushback from some of our more mature colleagues and really had to do a lot of education around like, that's municipal water that's coming from like Michigan, put into a plastic bottle with all those microplastics, put on a truck, being driven here, and now you're drinking the tap water that came from Michigan and you don't trust the tap water that's one of the safest in the country. So it was a really interesting disconnect, whereas the medical students would never buy a single-use water bottle. It wouldn't even occur to them to do that. Whereas our more senior leadership kind of was like, oh, why would never use a reusable bottle? So I think I've been told this by faith-based leaders, get to the children. If you can get to the children, you can get people to think differently. And so that's why we've really moved our sustainability efforts all the way upstream in education. So we're now part of the medical school and residency education around plastics and sustainability. So that was an eye-opener for me.
It's a great conversation starting point that you mentioned, Teresa. I have encountered in several instances where I am now that people don't trust tap water. Many people have well water, which has not been tested or treated unless they've done it themselves. So they don't know what's in it. It smells weird. I had a patient tell me last week that there's chlorine um, in her water, so she buys plastic. So plastic is an issue in and of itself, and it also creates space to discuss larger issues of health and good environmental stewardship.
Elizabeth.
Yeah, I agree. I do think that people have gotten more interested in it. I think it's been in the news all the time and people are talking about it. So I find even when I was trying to push through different plastics related initiatives at several different health organizations, like when I first approached them early 2025, like, December, January 2025, December 24, January 25, nothing, there wasn't a lot of interest, or it felt like, well, we don't have enough research or evidence. And then if I loop back a year later, in early 2026, then all of a sudden there was a reception, even though um, the evidence I had before and the line of reasoning I had before didn't change, but now it seems like it's become more acceptable, and also I think people are starting to see it all the time in the news. So now they're, I think, more willing to listen to some of the evidence.
Not everyone who is going to be on here today or watching the replay is a physician. So I'm curious, or even in a position of leadership, well, official leadership, you can be a leader and ambassador no matter your role. So I'm curious about what can a nurse, an engineer, a person on the finance team, how can they get involved and partner with the clinical side, which is massively important to have on board, but what can they do to start making an impact or even beginning a conversation?
I think just having the courage, or maybe they already have the courage and they just need to find a willing ear, but talking about it. kind of what you alluded to, Elizabeth, at the beginning, the pluralistic ignorance and fallacy that we are the only ones who care about this issue is real, and it's paralyzing for many. There are instances all over the country and world of non-clinicians leading the charge. So I think anyone can do it, and anyone should do it, but start small. We don't climb a mountain or go on a hike with the expectation that we're just going to catapult ourselves to the top immediately. We take one step at a time. So usually what breeds success is taking that initial step, following your passion or your interest, because you know it's the right thing to do, and it's better for everyone in the long run, and then just taking that first step.
Yeah, and I would say going back to our quality structure, so we have something called a CCC, and I think most health systems have some variation of that. It's a collaborative care council. It's basically a multidisciplinary group that comes together and they try to like solve problems from like, whether it's engineering or EBS or nursing. It's a very collaborative group. And they have safety rounds every month. And so what we did is during Earth Month, which is in April, we got onto their calendar and we actually trained the trainers, right? We would go to the sites and we would train the CCC on this one pager of like, what can a nurse do today to decrease their plastic usage? So one, bring your reusable water bottle to work, or when like I used to be a nurse, so I know this, you don't want to walk back and forth. So you fill up this big bucket of plastic, and you bring it into the patient's room so you don't have to bring it back and forth. But the problem with that, as soon as that patient's discharged, all of that goes into the trash, right? We don't reuse it. We don't restock that once it goes into a patient's room. So maybe think about what you're actually going to need today, or you're going to need in the next few hours, and maybe not bring that whole bucket into the room. And maybe don't stuff your pockets with all of this. We can work with engineering to put the supplies closer to the patient so that you don't have to put this all in your pocket. And when you get home, we're all guilty of this, undo your pockets. And what happens to all those tongue depressors and plastic wrapped? It all goes into the garbage. And so really getting people to think differently, right? You're the guardian of these resources. You can be responsible for decreasing the amount of plastic we're bringing into our buildings by changing your practice. And so really it's not magic, and it's not like earth science, rocket science. Right? It's really walking the floors and really finding where their pain points are and how we can help assist them to practice a little bit differently. But like most or all organizations, really, you have way more nurses than you do physicians. So engage your nurses, your PCAs. They are on the front line. They're the ones walking the walk and talking the talk. So we empower them to say, you can actually do something to decrease the plastic usage. And it's also a way for our team to get out and get seen. And now people if they have ideas, we created an email where they can just send an idea to us, and we get back to them pretty quickly saying, yeah, let's try it, let's do it. And so it's a bi-directional sort of exchange of information.
One of the big things that came out of the first webinar, and Liz, Elizabeth, I don't mean to cut you off, I'll come to you next, is the radiologists were talking about how in healthcare and medicine, there's a tendency to kind of hoard information or data rather than share. I'm curious, Teresa, if you've made any of those worksheets, like what can your nurses do today, if you've made them available, or if you would for the audience here so they could maybe replicate or
I have to look. I tend to make sure like whatever we have on there is shareable, but I think
of course
I could share some version of it. But
a version, yes, that would be great.
So what we start with is just really high level, like why is this important? And because healthcare is responsible for somewhere between 7 and 9% of our country's greenhouse gas emissions. So this is our call to action, and then we just put in there just some numbers, and then finally, what can you do today? And we're again, simple things, turn off the lights when you leave the room. Don't bring in all the extra plastic. So really tangible things they can do each and every day. But I'll have to find the last one to make sure that it's shareable.
Yeah, of course, please. And take your time. We can send it out at any point. All right, gear up.
Yeah, so I think we're talking about different ways to improve clinical care, but also it's come across through our comments as well. It's things that just happen in the break room or your office, even if it's separate from clinical care. The overall goal is to reduce the amount of unnecessary plastic. Obviously, we can't go to a totally plastic-free society. That's impossible because plastic does facilitate many important things that we need. But it's the amount of unnecessary plastics that we're using. And the scale of the problem, it's really large and sometimes hard to understand. So in 2020 alone, our world produced 547 million metric tons of plastic, and that's a really large number, and it's even hard to fathom. So if you were to gather up like all 8 billion humans on this planet combined, we only weigh 390 million metric tons. So in 1 year, we produced 140% the weight of the entire global population in plastic. And that's going to double or triple by 2060. And most of that plastic is getting burned or landfilled or littered. A lot of it can't be recycled. And a third of it is going into packaging, meaning we don't even really use it much. It goes away. So we're still wasting each year more plastic than the combined weight of the global population. So anytime that we reduce unnecessary plastic use, it's really helpful. I had a colleague who had soup for lunch every day from the cafeteria and got it to go. And he'd always get a plastic spoon. And I'm like, oh, maybe you could just bring your own spoon from home, like a metal spoon, and just wash it here. And he did. And that may seem frivolous, but actually it's the summation of all these small acts that actually lead to a large reduction. So I would say don't underestimate the importance of these small changes while we're still fighting for these larger systemic changes.
Great.
And the next step would be finding who's in charge of ordering your cutlery at your hospital and ask, can we not have plastic foods?
So I am very fortunate that we have a Michelin chef as our head of dietary, and he doesn't like the way plastic looks. And so one of the first things he said was like, why are we giving plastic to our patients? So he actually was really a great advocate for us to move to metal cutlery that's reusable. And at one of our sites, the cafeteria for our employees and our families, they actually charge you less money if you're willing to use the reusable, the glass, or sorry, the potteryware for your salad bowl, let's say, and the forks and knives that are going to be washed. So give you a discount. I think it was like 10 or 20, like pretty big discount for you to not use the plastic. So there's a lot of ways you can incentivize people. But yes, if you can get your food and nutrition people to agree that we should not be using plastic, and you can actually do the business model, it's cheaper to use the actual reusable cutlery.
And encouraging people to with a discount to use the reusables. There's a lot of emerging research in the psychology of sustainability that points to that helps raise awareness and will be one of those kind of impression points that will stick with them and hopefully hopefully transition or translate into other parts of their lives. Sustainability and the actions that lead to more sustainable choices is very similar to the behavioral consumer research that shows a brand needs to be in front of you about 12 times for you to remember who they are and to even consider them in the process. So every time a patient or a patient's family or a staff member is coming into contact with someone using a metal fork or being offered the discount for using the reusable, that's one of those impression points that you're helping shift the mindset and have a ripple effect. And I don't know that healthcare and medicine does a great job of thinking about themselves as part of the larger ecosystem of people's lives, that when they come to you, it's not in isolation, but you can actually help reinforce these are good practices because we're doing these here, and people pick up on things like that. I love that example, Teresa. That's great. So I do want to tell the audience to feel free to pop in questions or even raise your hand if you want to ask some questions. The conversation's been great today, but I want to make sure that we are hitting on the themes that you hope to. So who did I cut off when I came in with my monologue? Feel free to jump back in.
I'd just like to comment that one thing I'm encouraged by when we're talking about changing behavior, like bringing your own cutlery to the cafeteria, it is the kind of where the top down meets the bottom up approach. And one example that often comes to my mind is plastic grocery bags. So they're still available, but they're much, much less available than they used to be. And we've all learned to keep bags with us, reusable bags with us. No one was extraordinarily put out, I think, by the fact that they couldn't have a plastic bag at the grocery store. So we bring our own bags. They're not provided at the grocery store, so the top meets the bottom, and then we have less plastic. We have change. So I just wanted to comment on that since we were talking about BYO.
And I also think that when you ask people to bring their own water bottle, right? So how do you incentivize? How do you make it better than the one-use water bottle, right? So one of our sites that stopped buying the water bottles, they got some resistance from their leadership in the building saying, our employees are going to be very mad at us if you take away their water bottles. It's something that they're used to. It's what they like. They feel like it's safe. And so there was a lot of education. We tested the water. We put in a filtration system. And then the champion of that site actually went one step further. So the water dispensers, he actually upgraded them by a little bit, wasn't too costly. And it gave tap water, it gave seltzer water, it gave warm, cold, and hot water options. Obviously, we can't do that for our patients and families, the hot option, but in the break rooms and in the areas where the employees were getting their water, they now had an option to get all of these different types of water, and they were thrilled. And so I would say, if you're going to try to engage people and take away their plastic water bottles, which some people feel very strongly about, I would say, first of all, you do the ROI. We showed that it was actually a cost savings. We showed the impact to the planet. And going to the leadership is like, yes, it's going to cost you this much money for 1 year, but within 24 months, you're not only going to have like a return on that investment, you're going to be saving money because the amount of money you were spending on these water bottles. So it was a great incentive from a cost perspective, but it really incentivized the employees to be like, wow, I'm not missing something. They didn't take something from me. They actually gave me something even better. And so I would encourage you, like if you're looking at one-use water bottles, where you can, if you put it on a water station, you can upgrade it a little bit, and people then get really excited. Like, wow, I work at this place where I can get seltzer for free. So it was a great program.
What is a moment when you've hit a brick wall and you've had to take a step back and say, okay, well, that flopped. How do I start this again? Elizabeth?
I think usually if people, again, my effort is about on education and trying to, again, increase awareness through different health societies as well. So usually if I get pushback, if the pushback is an obvious no, then I might wait and loop back. But if it's not an obvious no, I'll say, well, can I at least meet with you and try to show you some more evidence about it? And usually when I can actually sit down with people and show them sort of the evidence about why we should be worrying about plastics as a health issue, from a climate perspective, from an air pollution perspective, from endocrine disruption perspective, and now emerging evidence from a micro nanoplastics perspective. Usually when I can lay out the arguments, people do start to see that this is something that's important to talk about for their societies. So I think just getting time to have a face-to-face conversation with some slides and figures that help visualize the point.
About 18 months ago, perhaps 2 years, time flies. The institution that I'm at, a department there, they sponsored some pilot grants, some many grants to fund ideas for employees, no matter what their job or position was, to see if they could implement and show how a sustainability or resilience program could have an impact and if it could scale. There were some super interesting projects that came through. And one of the stumbling blocks that I think was unexpected, both for the group that provided the funding, but also for the department that's sponsored this, was the blockade that was IT, because some of what they wanted to do, Teresa, I see you looking quizzical there, was to encourage patients to bring a reusable bag for if they were having a mammogram or other imaging. There were so many steps in order to get that layered into a patient communication that it was very clear that IT was going to have to be on board for so many of the projects. So I'm curious if you have seen that even on the quality and the tracking. So much of that is on pixels now. How do you approach that?
So yeah, I think you make a great point, right? Someone comes up with this great idea. Let's not keep using these plastic bags when people come for their mammogram and they just go right into the trash, and people can just bring their own bags and it'll be great. And it sounds great. And I can't tell you how many times I've had teammates come to me with a great idea and then the logistics start and you realize like this is not the sword to die on, right? This isn't going to work. And I think it takes just as much courage to say this isn't something we can do as it does to be like, yeah, let's do it. And I've learned that, you want to keep the enthusiasm when someone has such a great idea. And it's always disheartening when you have to tell them this isn't going to fly and here's why. But then you can turn your attention maybe to something else, right? I kind of say like, all right, I'll give you an example. Like we were trying to, I guess you all remember during COVID, all those gowns we were all wearing that were just, I would see the trash cans as I was leaving every day. And I was like, oh my God, we've just, and it's all plastic and it's not recyclable plastic. And we really wanted to see if we could go back to the good old days when people had washable gowns, right? I remember that when you would put on that cotton gown and then you would take it off in the patient room and it went into where the linen was. And that seemed like a no-brainer. Like that should be so easy to do. And I'm talking about this because I'm looking at my desk over there at my examples. So I don't know if you realize, but a one-use paper isolation gown is about this thin. You can put a whole like 50 of them right outside a door of an isolation patient. The actual reusable gowns are huge and they don't fit anywhere. And in fact, I'm going to show you something. I think pictures worth 1,000 words. So here I'm going to show you why this project didn't get off the ground. So this is a one-use reusable, a one-use, and this is 2 reusable gowns. So it became a logistic nightmare. How were we going to put 50 of these outside a door? We're a teaching institution. So when someone goes into a patient's room, there's sometimes 20 people that wear these gowns for just a few seconds. So then it became, we stepped back. All right, maybe we can't replace all these gowns. Let's talk about those 20 people going in the room. Do those 20 people all need to wear a gown? Do all 20 people need to go into the room? And so we started to like, if we can't switch from one to the other, what could we do to decrease the number of gowns we're actually using? But I remember that teammate being so frustrated that this seemed like such an easy thing to do. But then again, when engineering came in and said, how big a box do you want me to make? It's going to be bigger than the door. There's nowhere to put these gowns, but we used to do it. And, it's a challenge. But again, I always try to say, never let perfect get in the way of great. So maybe I can't be perfect, but I can do a little bit better than we were doing by decreasing the number of gowns we use. But you have to learn to say when it's just, this isn't going to happen.
That's a really interesting point. The reusable gown kind of looks like you're trying to stack a bunch of fitted sheets or up on the, like, we all know how those balance in the closet. Yeah, that's a mess. But so in sustainability, and I hear this from from other industries I talk with, it's often not just as you pointed out, reducing that one item or thing. It's thinking about how can we change what we do to reduce the resources that are that are necessary, because so much of what we do in healthcare is just kind of this status quo that gets things piled on top of it, rather than actually asking, is this a profession? Is this the best way to approach this for the patient and also the education? We do have two comments and questions. So someone pointed out that the water filling stations also have a health equity play, and that's a very, that is in ESG a part of that, and making sure that people have equitable access. And then we're asking, can hospitals provide their total annual spend relating to plastic waste, including handling, disposal, and associated processing costs? Oh, yes, I've thought about this a lot, and that's what helped
So it's
demonstrate.
challenging. Yeah. So if you may or may not be, aware, there's different scopes for your carbon footprint: scope 1, scope 2, and scope 3. Scope 1 and 2 are what the people think about. It's how you make your buildings more efficient. It's your light bulbs, it's your paint. Scope 2 is how you bring your energy in. We don't really have a say in that. Like, that's your municipalities and your oil companies, your gas companies. I can't control where they get their energy from, but that's scope 2. And scope 3 is everything else. And a lot of people call that supply chain impact for climate. So it's all the goods and services, and also like your investments drive that. It's about 80% of every health system's carbon footprint. The challenge is that no one knows how to do it all that well because it's price based. So you buy this unit and you spend this much money on it, and there's a strange conversion factor that I don't know where it comes from. I take this all with a grain of salt. It comes mostly from the manufacturers. And it gets even more challenging because we call it life cycle assessment, but life cycle assessment is just 1 second of time, because if they change where they're manufacturing something or they change some ingredient that they're using, the LCA goes out the window. So take this all with a grain of salt. Yes, we can measure what we're buying and what that carbon impact is from cradle to grave, but it's price based. So if I buy a more ecologically friendly item, but it costs me more money, it may look like my carbon footprint is going in the wrong direction because it's spend based. So with all that being said, yes, I do think that part of understanding your plastic usage is you need to get a baseline of what you're using. So for me, it's really where I sit in my office is actually very strategic. I sit directly next to the head of supply chain and the head of pharmacy. So sustainability, pharmacy, and procurement, we all sit within 10 feet of each other. And so we're always trying to figure out how we can do things with less plastic, whether it's with pharmacy or with what we're buying. But it is for every health system. That scope 3 is a challenge. I think we'll get better at it, but it's very difficult to say for sure how much plastic you're bringing in and whether it is better or worse for the environment because it's cost based.
And part of that is, what the vendors and the manufacturers, how they are making and packaging their goods. You can have the best intentions all day long, but if all of those items come in that hard plastic, how are you going to convince the manufacturer? There's a lot of research that's looking at types of paper, or and is it as safe to pack something with? Because in healthcare, it's essential to know that items that are coming in remain high quality and sterile. So that scope 3 is so tricky, and is it a constant communication between you, supply chain, and also the vendors? Because there just has to be a constant line of communication.
But just to further answer his question, so yes, you can put language into your contracts and your RFPs to vendors saying that you actually are interested in more sustainable options. So that language is now in all of our contracts with our vendors. The one thing you have to do with partnering with vendors, though, is that you can't charge us more money. Like, it can't cost us more because you're using less plastic, and that's always like a the challenging conversation. We want to be more green, but we don't want to spend the green. So, but we work closely with our vendors to make sure that the language is in those contracts around sustainability.
Okay, we're coming down to the kind of last few minutes here, and I wanted to ask, what, from your perspective, Annie, do you wish healthcare was having as a conversation about plastics? We know what's being talked about, kind of scaremongered in the news. We know what the kind of plastic industry proponents are beginning to push back on and all that. So, what if you could center the conversation? What would that be?
I really would go back to asking that question, why? Um, and in healthcare, we're always analyzing. There are QI projects, quality, improvement projects that could be done till the end of time. So there's a lot of analysis, and we prioritize infection control. We prioritize certain metrics that we get reimbursed for. I mean, there's a whole hierarchy on um, are enough patients on statins who are at a reasonable risk of heart disease. So we measure all these things. I would really like to see plastic be a metric. We all took an oath to first do no harm, and I do believe that we are doing harm in our current practice, and we really need to do something about that. I think I think that's incumbent upon us, so that we're really doing our due diligence. So I would really like to see the conversation become standardized. I would like to see plastic and maybe more generally just environmental indicators as a metric. And that is a long process, that it will not happen overnight. It's complicated. If you look at a map of the HHS, Health and Human Services, it's mind-boggling just to look at how many different departments and how many people are in each one and how they're connected. But I think we need to move the conversation up to the metric level, the reimbursement level, and that's where we will start to see some big change. It doesn't start there. I think we need to start locally, but again, it's the top down meeting the bottom up, and I think that's where we will move the needle.
Elizabeth, that kind of ties into some of your work around neuropsychiatry and how you've been thinking about plastics in the brain.
Yeah, so I think, in psychiatry, but also other fields of medicine, we have the biopsychosocial model, which is sort of thinking about all the different contributors that led to someone's symptomatology or illness presentation. And often that focuses on sort of biological, meaning sort of your genetics or different medications or drugs in your system, other things related to your body, psychological being sort of how you think about things and yourself in the world, and social being we also use the word environmental, but really what we mean is sort of like your family dynamics or your school or workplace, your neighborhood, as well as structural determinants of health like racism, poverty. And thanks to a lot of work for people doing climate medicine and climate psychiatry, we are starting to incorporate climate change as an extreme heat and extreme weather events into those formulations. But we as a field, and I would say actually in most of medicine, not just psychiatry, I don't think we've incorporated the findings from environmental health or toxicology literature, especially when it comes to endocrine disrupting chemicals like BPA, or now if something says BPA free, it probably just has BPS or BPF. So I don't think that we've actually as a field really incorporated those findings. I mean, the American Academy of Endocrinology has a whole 30 or 50-page brochure about endocrine disruptors, but I don't think I've ever encountered that until I got into this kind of work. So I really think we need to broaden our scope and think, why are we seeing so much illness now? Obviously, there are a lot of factors in how our society has changed, but when you think about endocrine disrupting chemicals, and they can be found in plastics or not in plastics. Those can have really large health impacts, and they can actually be delayed. So an exposure in utero can lead to effects 10 or 20 or 30 years later. And I do think we need to start having that conversation, because we have to stop being reactive in medicine and start being a little bit more proactive.
Teresa, how about you? What would you center the conversation as?
Well, I loved how Annie said before, be curious, not furious. When we think and go a little bit to what Elizabeth was talking about too, is like psychologically it can be very overwhelming, right? There's so much plastic, there's nothing I can do about it. And so I think the gloom and doom is not all that helpful, right? Like I don't like to start the conversation with like all is lost and we can't stop it. Plastic is not completely the enemy, right? Plastics has helped us do a lot of things we weren't able to do before. And, I would say, yes, you go into the OR and there's this massive amount of stuff that we use, but we're also saving lives and doing some incredible stuff, right? And plastics allows us to do that. What I would say is we should use plastic where we need it and we should stop using where we don't need it. So going back to the question of like, why are you putting on a pair of gloves to do a set of vital signs? That's just something I've always done. Okay, let's talk about that. Why do you do that? I feel safer. I feel like I don't want to get it. Okay, but is that real or is that like based on science? And so really getting to the why of why we're using this plastic in the first place. We're going to need to use plastic. We're not going to get away from it. But with all things, right? It's like, how do we mitigate the waste? And so going back again, I love that. Be curious, not furious. I think that's a great approach and really getting around the why people are doing it. And if we can facilitate something to change, to make it easier for them where they don't have to grab all that plastic that's not needed, like that's our job, right? That's our job to educate and then to support. And again, I also think listen to your front line. They're probably really interested in this. We just haven't asked the question. So again, you're going back to be curious, ask the questions and say like, who is interested in this and who wants to partner with us? And then, I think you do start small, but I get really excited at Northwell when we scale it, right? And then we really see this impact of like hundreds of thousands of pounds diverted. Is like that's a great story. But it starts with individuals actually wanting to do it and finding champions that want to support our team. So I think I like the more positive attitude towards it, like that we actually can do something. And we don't have to just say it's impossible. I think there's a lot that we could do. And I think, again, getting structure around your sustainability efforts is key. It's the land of 1,000 initiatives, and there's a lot of really excited people. So you really have to focus your efforts and really get a lot of structure around it so that you're able to show the metrics and show the change and then show the impact, because that can get your momentum. Like, when we get in front of our board and we show them all the work we're doing, it's like we're everyone's favorite presentation. So I think that also encourages people when you have the small wins, bigger wins, and then scaling your wins. But it's doable. It's 100% doable.
I love, and I think everyone's goal should be to do the sustainability work in their professional lives that make them the stars of the board presentations. There's always so much you want to be the standout, and I think that this can, because not only is it sustainability, but it's conservation and it's resiliency and it's reminding people that we are building to be here down the road. And it's such an important conversation. So we have a question. Would it be possible to continue the conversation directly, and how could people contact you if they want to be in touch? Whoever can jump in here.
I think we're opening our emails into the chat.
Oh, perfect. All right. I did not see that. I was looking at the screen, not the chat. Well, anything kind of last that you want to hit on before we close it out? This has been fabulous. I really appreciate your time. It's been a terrific conversation. Well, on behalf of Greenwell, thank you so much. And we hope to see you in the future.
Thank you so much.
Thank
Thanks.
you.
Thank you.
Bye.